not listed here. My error is HBOT, which is what we're going to be talking about tonight. And Dr. Sam Shore is a friend and colleague. Sam is a fellow of the American College of Physicians. He's a graduate of the Medical University of South Carolina. He's an associate clinical professor at George Washington University Healthcare Sciences. He became very interested and has written and researched on chronic fatigue starting in the late 80s, and this led him to seeing a bunch of patients with Lyme disease. He's very active in ILADS. He's given testimony before Congress and has served on advisory committees in the states with regards to Lyme disease. Sam is one of the true experts on Lyme in the country. He's been acknowledged on multiple occasions by his peers as a Washingtonian top doc in a checkbook magazine. And he's been granted national recognition for his treatment of chronic fatigue syndrome, fibromyalgia, Lyme disease, and is published in a number of peer journals. Sam got interested in hyperbaric oxygen therapy as an extension of trying to find better answers for his patients that were not responding to other more conventional therapies. And he's done a huge amount of research in the process of bringing HBOT to his rest in practice. And we're privileged tonight to have Sam here to talk about that. So please give Sam a hand.
Thanks, Dr. Kaplan. It's a pleasure to take the opportunity to speak to you tonight. As Gary said, it's my interest, since I've been in practice since the mid-'80s, has been chronic fatigue, and it's been in the last 10 years or so that I became interested in the potential connection between Lyme disease and chronic fatigue, and published a paper 3 years ago where I believe I provided evidence to support that the majority of the patients in the analysis that I provided in my practice who had international case-defined chronic fatigue syndrome with blood test negative Lyme disease actually had seronegative Lyme disease and responded to antimicrobials accordingly. And in my attempt, as Dr. Kaplan alluded, to manage sometimes very challenging patients, expanding our options, I became interested in hyperbaric oxygen, and that's takeoff of the talk tonight. Okay, so what I'm going to define first is what is HBOT. A slide or two over safety. Mechanisms of action, I think, are going to dovetail very much into what Dr. Kaplan alluded to in terms of inflammation and other factors that can be addressed with this modality. And then as an extension of that, what indications might be of value in considering this intervention. To begin with, you can see there are small monoplace where an individual slides in here, or multi-place chambers. Basically what we do is introduce 100% oxygen into the chamber that has the capacity to apply pressure. That's the hyperbaric. Baric is the pressure piece. And what we're trying to do in this setting is, this is what it normally looks like in the blood, where red blood cells are normally 97% saturated. So adding another 3% really isn't going to do very much. But what this technology does, it supersaturates the plasma. And that's what generates what we're going to be talking about later on. A couple of terms to define. ATA stands for atmosphere absolute. 1 ATA is room air. The chambers have the capacity to go to 3 ATA, or the equivalent of 66 feet below sea level. You're not really diving, but you're still in the chamber, but it feels that way. And what we're doing is, if you can see, 21% is what the normal saturation in room air that you and I are breathing here now. 1 ATA, as I said, is sea level. So the tension, oxygen tension, just for arguments, is 100. If we go to 100% oxygen, that increases it by 6.5-fold. If we do 100% at 2 ATA, or 33 feet below sea level, it increases it to 1,400. And at 3 ATA, we can increase the oxygen concentration by 22-fold compared to what we would breathe here today. The side effects, as you might imagine, because you're being put under pressure, are primarily related to pressure. So if you have difficulty, for example, flying in an airplane and accommodating to that pressure, that's an issue that needs to be addressed. That's clearly the most common, but even then, that's not all that common. Sinus pressure as well, and the other phenomenon that can potentially occur are incredibly uncommon. The FDA has approved the following 13 indications, including decompression sickness, or the bends, which most people think about, among other conditions, including neurologic conditions and wound management. But that's not what we do. This is more of what we do, and that's what this talk is about primarily tonight. So I'm going to be talking about what Dr. Kaplan alluded to in the plasticity of the nervous system. When we were in training, we were led to believe that the nervous system was quite static. It couldn't really change. You damage the nervous system, a tincture of time, and then that's all you're left with. Well, in fact, this technology has proven that concept wrong in spades, and we'll talk about that. So we'll deal with a number of phenomenon that I'll go over in detail, alluding to chronic fatigue, some GI, urologic conditions, and then we'll end up with Lyme disease discussion. So why does this matter? Well, among other things, this hypersaturation or hyperoxia, increased saturation, concentration of oxygen, can turn on over 5,700 genes that can impact an upregulation in growth factors, decrease swelling, promote neural pathways, waking up sleeping nerves, and we'll talk about that in more detail, downregulating inflammation. Again, this dovetails into very much of what Dr. Kaplan was alluding to. So a major impact, the mechanism of action, is enhancing the healing. Antioxidant effects. Now, one of the concerns that many people have when they're first represented with this concept is, well, you're introducing all of this oxygen. Isn't that potentially dangerous? Because you can have toxic effects from oxygen and free radicals and reactive oxygen species that are highly charged and can be carcinogenic. Well, oddly enough, there's a concept called the hyperbaric oxygen paradox, which actually compensates for that very concern, such that the body's response to this environment of increased oxygen concentration is to produce more antioxidants. And that could be done in a number of ways, both enzymatic and non-enzymatic. Glutathione production, which is one of the most potent antioxidants known, is increased production as a result of this intervention. So that, in fact, the antioxidant response, many feel, may be as important, and perhaps in some cases more important, than the oxygen effects. And so that there are multiple factors that are playing a role in why this does what it does. They're alluded to decreased inflammation, and that certainly is an important factor in a number of conditions. So that a number of factors, as I've alluded to here, have been noted to be decreased as a result of this intervention. There's an improvement in mitochondrial function. Mitochondria are part of every cell. They're the powerhouse of every cell. And without the function, adequate function, that cell, that tissue, that system is not going to work properly. This has the capacity to improve that function. And I'll go into this in a little bit more detail, but very often there are stunned neurons whose mitochondria are only producing enough to survive, to stay alive, but not to function. This intervention has the capacity to turn them back on. That's the plasticity of the nervous system. And so that there is a neuroprotective effect of hyperbaric oxygen and brain injury mediated through this mitochondrial property. Protects against mitochondrial dysfunction, delaying motor neuron disease that we'll talk about in a moment. Promotes angiogenesis. That is the production of new blood vessels. So it improves the delivery of blood to tissue that may be damaged. And that is, by one mechanism, is an increase in something called VEGF, or vascular endothelial growth factor. Basically, it's a hormone that stimulates the body's ability to increase production of blood vessels. And there are a number of authors who support this concept. Fibroblasts, those are important cells in the healing process, in wound management, any wound. and other growth factors have been noted. And again, a number of authors support those concepts. So we talked in large part about the healing and the many mechanisms of action by which that can occur. There's an anti-infective component where, in fact, this hyperoxia or the increased oxygen concentration actually has a direct effect on either static or slowing down of bacterial growth, or cidal, killing bacteria, just independent of having antibiotics on board. Just the fact that high oxygen concentration can do that. And that direct effect may, in fact, be related to these free radicals that we alluded to, but that bacteria don't like. And particularly anaerobic bacteria, those are bacteria that like to survive in a poor oxygen environment. This is that much more effective. But even bacteria that survive in an aerobic environment can also be impacted by this. It can improve white blood cell function, which are important for fighting infections as well. And one mechanism is phagocytosis, which is eating the bacteria that the white cells are doing. And interestingly, I alluded to the fact that mitochondria are important for the production of energy, and they are, but they're also important as host microbial in the host microbial interaction. So the fact that their function is being improved by this phenomenon contributes to our ability to fight the infections, the anti-infective component to it. And immune modulation, a number of factors have been noted to be beneficially altered. The nervous system is a really hallmark feature of, from my standpoint, of much of what it is that we treat. And we alluded to this plasticity. Well, why is it plastic? What is it that we're doing that allows this reversal of damage and disease? Recognizing that the brain is one of the heaviest oxygen consumers, accounting for 20% of all the oxygen consumed through our body. Yet, it's generally, oxygen levels are very low. And so that neurogenesis, or stimulation of nerve cell production, is an important feature. There's an increased activity of neural progenitor stem cells. In fact, in this study by Tom, the measurement of these stem cells was significantly increased after this treatment session with hyperbarics. So that in the rat model, hyperbaric oxygen promotes dramatic improvement in learning and memory, neurogenesis, affected by stimulated neural cell proliferation. And this is seen in adults as well, and Mito and others feel that this is an important mechanism of action for why this does what it does.